physician might not think about public health when they do their job, but so many jobs are a part of keeping society healthy or well or creating the conditions where we're well. So it made me think you have volunteers picking people up or directing people, directing traffic or anything related. You wouldn't think of transportation as public health, but it absolutely is. It's a piece of public health and creating a community and a society that can be healthy.
Absolutely.
So a few years ago, not a few, many years ago, I lived in the Bronx and I had a car. I didn't really shop in the neighborhood. I drove to Westchester County and to shop because they had more of a variety. And I really didn't understand what the hubbub was about because the communities were very upset that they were getting secondhand vegetables and the vegetables would come in and they're almost spoiled and the cans were dented and all kinds of things. And the communities leaders fought and to get better supermarkets, better vegetables. And for some reason, I started to go to the supermarket in my area. I didn't realize it was unconsciously I was doing this because I would go to the supermarkets. They wouldn't have what I needed. So I would go to Westchester, but I had that opportunity to jump in a car and drive. So what about everyone else who can't?
Absolutely. And this is why Liz and I both said that those communities are underprivileged, and that is the goal. The goal of public health is to turn around the unavailability to those residents to availability of those residents or of those resources for those residents.
And it may
Right.
sound simple, vegetables, you know. Yeah, who cares about vegetables? You know, in the Bronx, you go to every corner and you see a what is that chicken? It is a place where you could buy chicken or a Kennedy Fried Chicken is one of the places. I'm giving them some ad, but they're everywhere, and it's so easy for someone to just jump and go there and buy junk instead of being able to buy something a little healthier. Not
Right.
they, they can't even buy a sandwich. The chicken spot is more accessible than uh, a place where they can buy a healthy sandwich for lunch. So hence,
Exactly.
heart disease and all of these different things that they come into the hospital now that Liz and I have to help them get better and leave. Anything else, guys?
I would just add that I
Well,
think, or
Go ahead, Liz.
I was just going to say, it just made me think when you mentioned that community leaders and folks in the neighborhood were said that they wanted better produce. I love to hear that because two things we would want to see from a public health perspective is people, and Dr. Carr already mentioned this, we want to see people advocating for themselves because that's really powerful to be able to say, this is what we need in our community. But public health also assumes that the government has a responsibility to support people, to help people. That's an assumption of public health. So it's important that business leaders and local politicians get involved and listen to what people need because the government should intervene and support communities. That's an assumption of public health. It just popped into my mind.
Absolutely. Absolutely. The same way that we are given those members who are opening up McDonald's grants to open businesses that are not supportive to the health of the local communities. Liquor stores. Let's talk about how many liquor stores are in each community. I gave my students one time that they're supposed to get on the bus on a Sunday and ride from the city into the closest suburban area and just take their time and look out the window and watch how the dynamics of those communities change. One of the things that I talked about that changes is you'll see neighborhoods that have lots of liquor stores. You'll see lots of McDonald's. You'll see fast food places all over the place, bodegas, you guys call it in New York. We call it poppy stores over here in Philadelphia. Same difference. These stores that sell a lot of processed food, and the goal is for them to realize that it's not by coincidence that their communities are set up this way. The same way that a Wawa in the suburban area is spreaded maybe 10 blocks away, and there's probably just one liquor store available to communities. We would like our communities to be saturated with those produce junctions that we talked about, as well as those healthier supermarkets lined up with fresh fruits and vegetables available for the residents.
I know when I go to Philadelphia, my car, the back of the trunk of my car is full. Because I could do with $60. $60 goes so far at Produce Junction, so far.
Well, my community is saturated with pizzerias, so I guess that's why I eat way too much pizza, you know. So, you know, talking about and staying on the topic of healthy foods is a lot of patients come in from these neighborhoods, and we feed them healthy food and we restrict or reduce their sodium, and we take great care and make sure they're on a carb-restricted diet, perhaps, that's diabetic friendly, and give them lots of fresh vegetables and fruit and 3 to 4 meals a day, snacks when you want them. A lot of hospitals now have room service where you can pick up the menu and you can order and eat anything you want at any time. So when patients go home, it's important that they go home with education. So when they go back to, their neighborhood, their home, that they can hopefully maybe take some of those healthy habits and recipes, because many hospitals have teaching kitchens, and hopefully they can take that information back. That's the goal. I don't know how successful that is, because it's hard to monitor what people eat and their behaviors once they reach home. And certainly if they don't have access, then they don't have access.
I was just about to touch on the access, because in my community, where I am, I have to drive to the supermarket. It's about a mile away, a little more than a mile, and I can't walk there. You know, I could probably walk with a shopping cart, but I don't have a shopping cart. So imagine someone who's 60 or 65 who live in an urban area, where the supermarket is 2 blocks away, but the supermarket has nothing, and this person always ends up in the hospital because instead of good drinking water, this person drinks Pepsi. I know of that to be real because I lived in a community where one of my neighbors, that's all she drank was Pepsi. She wouldn't drink much water because Pepsi was cheap. You can get a lot of it for less than water. You can get a 2-liter bottle of Pepsi for cents, and a 2-liter bottle of water was $1.50, and the 2-liter bottle of Pepsi was 69 cents in our community.
Not to
So,
mention in places where the water isn't safe to drink
right,
out of the tap. Yeah.
you have
Yeah.
areas where lead is in the water,
Hmm.
and you're fighting the government to fix it. How can you fight the government to fix unhealthy drinking water? Dr. Carr, you were saying something?
No, I was going to say that is absolutely so true. Rural communities often suffer as well, and not just city communities.
I have a question, and this actually came up with a few of my frontline team members today. They, of course, have health insurance. They're very fortunate to have it. We're fortunate to have and work for a healthcare organization where we have great benefits, and a lot of their family members are on their benefits. But when their dependents reach a certain age, and for people that don't have jobs or don't have health insurance, you don't have dental insurance. How is public health going to start addressing, or is there any plan to address dental care? Because so much of poor dental health has to do with, diseases later on in life. And, nobody wants to be, a lot of times you'll see people having teeth pulled versus having root canals because it's $100 versus $1,000. So what can we do to help that situation? It breaks my heart.
Yeah.
Absolutely. One of the
really
things
good
that
point.
Liz is probably a little bit more savvy in is the legalities of public health. That is another step that we really don't talk about that much. But public health also is a part of changing the laws and learning the verbiage that is written. For instance, not only dental care, but mental health. That is something that public health advocates pushed for, and this is why now mental health. I remember a few years ago, maybe about 8, when the Obamas were in the White House, when Michelle Obama had made the statement that mental health issues, are there limitations on mental health care? You could only go into the office for maybe 3 visits unless you were on public assistance. And she made a very good point about mental health not being taken seriously, and it should be taken seriously the same way that we do our physical health as well as our dental health. It's all in line. And lots of people really don't realize that your teeth are connected to your heart and your bloodstream. So if you don't have healthy teeth,
that is correct.
you can end up having health issues.
Heart health. Yep.
Yeah.
And
a lot of the patients that don't get those items get those issues addressed, they come into the emergency room, of course, looking for pain medication because toothaches hurt.
It's incredibly painful. Yes. Yep.
So we've come to our 30 minutes. Doctor, you were saying something, Liz?
Oh, I agree, and really quickly, I would just say it is about that involves the part of public health where we have to advocate for changes to laws. And great point, Linda. One thing that was, or Dr. Carr, really important while President Obama was in office was that we did see changes in laws regarding mental health parity. So basically health insurance companies should treat mental health care similar to any other form of health care in their coverage of the care. And I just think the same with dental care. It would be great to see changes in how the law addresses dental care and the laws that govern our health insurance companies. And one small thing is we also need, from a public health perspective, to encourage healthcare providers in these fields as well, because we do have shortages in mental health care providers, especially in rural areas. And there's a shortage of dentists that accept patients with certain types of health insurance as well. So that's another public health issue, is the